we're doing the presentation, I just asked if everyone could put some of those questions you have during the presentation in the chat box, and we will make sure we get those answered. But I do want to allow us enough time to get through the training so that we can see what's going on before we answer those questions. So thank you so much. All right, so this is just going to be a refresher training specifically for using the CCT as an MCO administrator. So I know we've had a lot of questions come up recently from MCO admins who are starting to get into the tool, that things look different than the provider's side. So wanted to just go over those again because those views are very different. Okay, so today we're going to be just shining a light on the MCO admin's view. So we're going to be comparing the views of an MCO administrator versus care coordinator and practice administrator, excuse me, going over the specific landing page and the different sections of the tool. So that'll be 3D analytics and then the Care Connect Pro, and then we'll open it up for questions. All right, so starting with the comparison of views. So the MCO administrator has access to 3D analytics, and this is where the bulk of data comes from for MCO administrators to see within the tool. So within 3D analytics, you have access to all of those reports, which will be at the organizational level, at the practice level, and the care manager level. So the only difference here in reporting that you would see as an MCO admin versus a care coordinator or practice administrator is that you're able to see at an organizational level since you're contracted with multiple practices. So it gives you an overview more aggregated of all of those practices together. But then you can go down and divvy it out into a specific practice, see how a practice is doing with their quality measures, for example. And then you can also go down into a specific care manager level, such as a practice administrator has access to see productivity and call logs. Most likely, you'll probably be spending most of your time in that organizational or practice level. And I'll jump into the tool to start displaying this in just a couple minutes. The other aspect that you're able to see in the MCO administrator view is in Care Connect Pro. So here is where you'll have access to that ADT data, or admission discharge transfer. So that's going to be able to give you all the ADT data, the same things that a practice administrator or care coordinator would be able to see based on that feed we get from the THA. You also can see forms, resources, and education, the same as a care coordinator or practice administrator. And this is where we have things like the coding guides that go with the HEDIS measures. So things like that you'll have access to as well. The biggest difference here is that care coordinators and practice administrators have the member search feature within CC Pro, and that's where they're going to be spending a lot of their time outside of the ADT. So that is giving you the ability to search up all of your member panels and pull a member panel for a specific practice. They can go in and choose a specific member from there and see a specific care plan, make notes on follow-up. So it's much more member-centric care that's provided in that section, which is why we don't have that for the MCO view, because we cannot link you to every single practice the way the logic is set up for this tool. So that is really the biggest area where you would see the difference. And I know some of you have already said that you've heard from members questions on the member search area that you're not able to see. So for any questions that they have on the member search area, they can reach out to us either at the technical support desk if it's something doesn't look right at our HealthEC support desk, or they can reach out to us at the 10care.cct@tn.gov for questions to be answered. Okay, all right, so let me just jump into the tool now so you all can actually see what it looks like. We'll just give it a minute to load. So when you log in as an MCO admin, you come to this specific landing page. And this is different from the care coordinators and care providers, again, since your view is different. So you have the option to to go to 3D Analytics for those reports, or you can go to the CC Pro for the ADT or Forms and Resource section. So we're going to start with the 3D Analytics section, since a lot of what you might be wanting to see is in the reporting features. So we'll go ahead and click on that and give it a second. Okay. So in the 3D Analytics as an MCO admin, again, you have one different filter that's different from the practices, and that's this organizational level. So choosing this, any of the below sections is going to give you the overview of how all of the practices are doing, whether you're looking at quality measures specifically or maybe enrollment as a whole. So for example, we'll click into enrollment right now. This is going to show you what those enrollment numbers have been for the MCO as a whole. So if you're in as Mayor Group, you'll see your numbers only. If you're Blue Care, you'll see your numbers only. Same for UHC. So you're only able to see your data specifically. So we have additional filters. So we have line of business. This is always going to be Medicaid. You don't have to worry about checking this. This will already be automatically selected. You do have the option to specifically look at enrollment over PCMH, or if you're looking specifically at THL. Your health plan will auto-populate here. You don't have the ability to search for anyone else, so that's not something you'll have to worry about. And then you can choose time period. So if there's a specific year that you're interested in looking at, I'm going to keep it at 2020, and we're going to view report. Viewing report just means it's updating the pull of the data based on the lower level filters that you just set. So we can see here that it's now breaking out just for the practice what the enrollment has been over each month of the year for 2020. And below that, it goes into a little bit more detail where we have it broken out into age group, and then the age group broken out into the gender, and then total numbers, and then percentages. From here, you can export to Excel, CSV, PDF, or RTF. So again, this is just a high-level overview of what you'd be able to see. Now, if you're wanting to look more at practice level enrollments over a year, that's where we change our overhead filter to practice. And we'd have a few different filters to then pull the report by. I'll give it a minute after clicking practice. All right. And you can see already it shows a little bit differently. So again, line of business will always be Medicaid. You can choose if you're wanting to look at PCMH or THL. Your health plan is what will auto-populate here. And then you would be able to choose which practice you're interested in seeing. Then you would select the year that you're interested in, and then click View Report. So once that report is pulled, again, you'll see similarly the breakout of what your overall health plan enrollment has been over the year by month. And this is specifically focused on PCMH program. Below that, we have the same breakout of members by age group and their gender. But we also have specific individuals who'd been enrolled in the program by month. So if you're wanting to look at a specific month, you can see here, January is selected. So if you're wanting to choose, a different month, you would go ahead and click on that. So if maybe it's February that you're interested in, you would click the number under the month, and it would change the member details to that specific month. From here, you can also export to Excel, CSV, PDF, or RTF. So Excel would be able to give you a bit more ability to do more data analysis or tweaking of the data. Great. All right, so quality measures I know is where we've been getting a lot of those questions. So I want to go over specifically to quality measures. We're going to keep it on practice right now. I do want to point out that this is what you would see, and the same thing that practice administrator, if they're logging in to see the numbers for their specific practice as well. So we have practice, quality measures, line of business, always Medicaid. Type of coverage, again, you can choose specifically if you're wanting to look at PCMH or THL. Let's just change it up for this example. We'll go to THL. Health plan is always going to be your health plan, and then you can specify practice here. You do have the ability to choose multiple organizations, so if that's easier for you, you can definitely do that. Or if you're, wanting to get all the practices, you can just check the box up here next to practice, and it will auto select all of the practices. If you're wanting to get more granular for a specific practice, then you can just choose the one. And then for quality measures, it's going to only have the option to pull up those specific THL numbers. And then time period. So you go ahead and choose the specific time period you're looking for. And then we will view reports. So here, again, this is going to be, we're focusing on Centerstone for this practice. And again, this is training environment, so all the data is de-identified and not up to date and not even necessarily for Centerstone. So just wanted to point that out there. So we can see all of the THL measures for this practice listed out here under behavioral health domain. We have our cardiovascular condition domain, our comprehensive diabetes. So all of them are broken out by domain. Under each domain, we have each of the specific measures. If you hover over them, you're going to be able to get just a highlighted definition of what that measure is. We have an overview right here of what you'd be looking at. So we have members that have met the specific measure, those who have not met the measure, any that are excluded or have an exception, and then the denominator. Then we have a quick overview of performance. And so the orange is going to indicate the practice's performance towards that benchmark. And the benchmark is highlighted by that red flag. The next column is a helpful way to see the percent variance for how well the practice is doing towards that benchmark. So it'll indicate if they are below tracking or if they've already exceeded the benchmark. We also have a number to indicate how many gaps they need to close in order to meet the benchmark, how many gaps were closed by claims or clinical information versus those gaps that were closed manually in the tool. So with this CCT, we do have the ability for users to say that they have closed a gap in care for care coordination purposes only. So it will close it in the tool, and we would be able to see here which of those have been closed manually. But we have trained all of our CCT users to understand that closing manually within the tool is just to keep the care team up to date on what care measures are truly open right now. To formally close a gap in care, there must be a claim that is submitted and go through that process. Once that claim is submitted, even if they had closed it manually within the tool, it will update here and we'd be able to see the claim that closed the gap in care. I wanted to just clarify that for all of you. So we can also get a little deeper dive by clicking this little plus icon into the measure. And this is going to pull up more specifics on who has met that measure, who's not met the measure, who's been excluded, and the denominator. So it automatically selects those who've not yet met the measure, and it'll list out each of those individuals specifically. So we have the information would be member ID, the MCO member ID, the member's last and first name, their gender, their age, their TennCare enrollment status. We'll have their phone number and their address, and then any related screening results, code descriptions, the date anything was documented or performed towards that, and that rendering provider. as well as the source. So this is again where you'd see something was closed by a pharmacy claim, professional claim, or manually. This can be exported, so we can export to Excel with the specific measure that we're looking at for this practice. So if you're wanting to see, for example, just those members who've not yet met this measure for the practice, you can export directly to Excel and be able to do more data analysis, or practices maybe use it to assign out to their care coordinators. We also have the ability for CSV, PDF, and RTF. With this view, there's also the all members export to Excel, and that means it's going to export all members for all of the measures for this practice into an Excel. So that's available as well, and may be useful for you. Before we do that, I do want to show you just what this would look like if I were to only export just the view of those not met. So we're going to choose Excel and then click Export. And, you know, just doing it for a single measure and those not met does not take as long, but especially for MCOs, if you're looking at multiple practices and want to get all members and all measures, that can take a few minutes. It's not something that needs to be done after hours or anything, but it will take a couple minutes since it's a lot of data. All right, so this not met report looks like this in Excel. And again, this is the same thing that a practice administrator or a care coordinator would see if they followed the same steps to export to Excel just those not met members. So we can see again just that high overview, the number that have met, not met, or were excluded from this specific measure. We have the percent performance, percent variance, gaps to meet the benchmark, gaps closed by claims, and then any gaps closed manually. And then we have all the breakout of the individual member data. So again, the member ID, last name, first name, gender, date of birth, their age, TennCare enrollment status, and their contact information. And then scrolling over here, we can see any screening statuses results, code descriptions, date documented performed, rendering provider, and then the source, whether that was a pharmacy claim, a professional claim, or closed manually. Yes, phone number is usually included. Great question. Since again, this is training data with all the same addresses, we don't have phone numbers in here for the training environment. All right. Any other questions on the export or just looking at the closed or not met measures at this point? Great. Okay. So Carolyn, I do see your question, and that's a great segue right into our next one. So I'm going to go ahead and jump into the next section. So we've focused on this not met. We can also see those who have met, but as Carolyn has asked a really good question, how would you close a gap manually? So as an MCO administrator, you do not have the ability to close gaps, but you can click on this hyperlink to a specific member, and it will pop up with what the specific open gaps in care are for that member. And so in the training environment, we don't have any that currently have open gaps in care, but for this member, if they had any gaps in care, they would all be listed out here. As a care coordinator, you would be able to click on that specific open gap in care, and it walks you through steps to manually close it. So it's asking when it was performed, what was performed, by whom, and then you'd have to attest that this actually did happen, and you'd be noting whether it was during the visit or if you got the information from an EHR, for example. So that's how you'd be able to manually close it. So again, MCO administrators can't manually close gaps in care, but you can see the list of all the measures for a specific individual in question. All right. So then if you're wanting to see all the members who have met their gaps in care, you can click on the MET and it'll pull up all of those members. We again can see the same information up here as the header. We can also click on the little plus icon next to the MCO member ID. And that's going to give us a little bit more data on what may have helped close the measure. So we can see that we have several pharmacy claims here from different dates that are helping to close this measure. So we can see that they're consistently getting this citalopram, I think is how you say it, and then the date documenting rendering provider, and then again that the source is a pharmacy claim. This data can again also be exported if you're wanting it just the MET members, keep it at the Excel rather than the all member Excel. All right, any questions on seeing those members who have met a measure? Okay, great. All right, so if you're wanting to just have a high level overview, you know, just how the practice is doing for measures, or wanting to get all the granular detail for every single measure, that's when we're going to choose the all member XLSX and then click export. Again, if you're going to be choosing to do multiple practices, which you do have the ability to do as an MCO administrator, it will take a couple minutes because that is a lot of data to pull. If you're doing it for a single practice, it'll be pretty quick. And so I'm going to give it a minute to just pull that up, and I will show you what that looks like. Apologies for the delay. Sometimes it does take a little bit longer from my end because I'm sharing my screen in the training environment. Here we go. All right, so here is what the all member XLSX Excel report looks like. So we have each of the domains listed out here, measure, the member ID, last and first name, all of the individual identifying information for a member, any screening results that have been reported, codes and descriptions related to the member and when they were documented, the rendering provider. We also have the source, so whether it was a professional, institutional, pharmacy claim that came through, or if it was closed manually within the tool. And then it will indicate measure status, so whether the measure is open or not met for the member, or if it's closed or met for the member. So within Excel, you can do much more data manipulation. You know, we can throw a filter on here and filter out by specific domain. If you're interested, you could look at a specific member if you're wanting a specific member to see all of their gaps. So a lot of data manipulation you can do within Excel. And this is a report that the providers are also able to export from Excel as well. Okay. Annie, are you able to see it now? It looks like you may have lost connectivity. Yes, okay, perfect, great. So good question. So can care coordinators close the gap manually by referencing the medical record retrospectively? So they can indicate that it has been closed if they're reviewing the, their EHR record or paper records. They would indicate that when choosing to close the measure. But as we educate all of our CCT users, doing so does not formally close the measure. There still has to be a claim that follows up and is sent to those MCOs to be processed first. That's the way those measures are formally closed. A good question. All right, any other questions on the export view for the quality measures? All right. Okay. So more infrequently, but you do have the option. If you are interested in seeing information at the care manager level, you do have the ability to do this. This is something that's most likely going to primarily be used by only our practice administrators to help with reviewing care coordinator productivity for their practice, but you do have the ability to see this. You can look at information by a call log or productivity. Productivity is probably something you'd be a little bit more interested in seeing. And we have the same type of filters, but with date ranges that we've seen in some of the other reports. So you can look at either THL specifically or PCMH. Your health plan will always be automatically chosen. Then you can choose a specific practice. You can also do all practices. I'm going to keep it with one for right now. And then you can choose specific care coordinators. Again, since it's a training environment, they're all fake care coordinators. But if you had one in mind that you were interested in seeing how their productivity was, you'd be able to choose them. Or just see how all the care coordinators are doing for a practice. So program status, you have the ability to search by those who are active, attributed, not enrolled, discharged, or inactive no BH treatment, specifically for THL. If you're looking at PCMH, it's only going to be active that you can choose. But let's say, for example, you're wanting to see for those active and attributed, not enrolled, add that. You can choose the date range. So whether you're wanting to do last week, last month, last 3 months, etc. Or if you're wanting to select a specific date range, you can do that as well. I'm going to go ahead and keep it at the last year just so we have enough data to look at. And then we're going to click that view report so it pulls all the data based on our filters. And so here you can see just a summary view, how many assigned members, average prospective risk score of assigned members, caseloads, overdue tasks. CMRs would be comprehensive medication review, so this would be for MTM only. That would not be helpful for those care coordinators. And a lot of other different items here. We also have productivity summary, which gives it in a different view that probably would be a bit more helpful if this is what you're looking at. It's going to list out each of the care coordinators. So if you've chosen multiple, you'll have them all at the column header. And then the information based on each of these list outs here. So this type of information can also be exported so that you can do a little bit more data manipulation, or if you want to use it in a coaching call, you have that ability to be able to export that here. Questions on the care coordinator productivity view? And I will just put a caveat here, assigned members is only going to populate if the practice is doing the practice of actually assigning members to care coordinators. So practice administrators are the only ones who have the ability to assign members to care coordinators. They can assign to a primary and a secondary. So as long as they're doing that, this would allow you to see how many members were assigned to each care coordinator. And this report, again, is only something that a practice administrator would be able to see. A care coordinator would not be able to come in and see how their productivity is looking, or any of their care coordinator colleagues. So it'll just be the practice administrators and MCO admins who have this view. Okay. All right, before I jump over to the Care Connect Pro, are there any questions on any of the report features? Great. All right. I'm going to go ahead and jump back to our landing page. So you can do that by clicking the PHM little back button. And it takes us back to the MCO admin landing page. So we've gone over those reports in 3D analytics. Now let's jump into the Care Connect Pro. And so primarily what you would be doing here is looking at that ADT information coming through. Right. So from here, the view of ADT is very similar to what a care coordinator or practice administrator would be able to see, except that you don't have the ability to search by a specific care coordinator since you are able to see information for all the practices that are contracted with you. So that's the big difference. Otherwise, it's going to auto-populate any of the most recent ADT information sent over for your members. You can also do a more detailed search based on specifications that you're needing. So if you're looking for a specific member, for example, you could search by a specific member. If you're searching for a specific member, you have several ways that you can enter their information. So you can enter their full last name, comma, full first name. You can do full last name with a partial first name, partial last name, comma, full first name, or their last name only, first name only. So a lot of different ways that you can do that. You can also search for specific time frames for admitted and discharged on. So the way that this search engine works, it's an and or. So you can search for members who've been admitted in the past, let's do 6 months. And we would also need to set the discharged on. So we would want anyone discharged, let's say also in the last 6 months as well. If you're wanting a more specific time frame, you can always select other and then choose the specific date range for admitted on that you're looking for, which would be the from and to here. Or if you're looking for a specific discharged on date range, you can choose other and the specific dates here. You can also select specific source. So if there's a hospital or health system that you're really interested in seeing those specific ADT information for, you'd be able to do that here. You can only select one at a time here. So we can also focus our search on status. So if you're wanting to just focus in on those currently admitted, you'd be able to select that here, or those who've been discharged, you'd be able to focus on here as well. You can also narrow down the search to visit type. So if you're just wanting to see those emergency room admission or discharges, you'd be able to do that, or inpatient, you could do that here. If you're wanting to search by ADT information by a specific provider, you can do that. So we would click on the little magnifying glass next to assigned provider. And here you can search by a specific practice. So maybe it's not just one provider from practice A, you're wanting to see all the providers from a practice. So let's say maybe we're wanting to see VIP Mid-South practice. We could type in VIP, do the little magnifying search, and it's going to bring up all of their providers. So if we're wanting to see everybody, we'd go ahead and check the little box up at the top, and it'll select all the providers with VIP Mid-South. If we're wanting to just see one of those providers, you could go ahead and click the one that you're most interested in. Just since we're in a training environment, we have all, again, de-identified data, so I'm not going to select anyone specifically because I want us to have some data to actually look at. And again, if you're not wanting to search for a specific practice, you want just one single provider, you can search by their last and first name and pull that information up. Okay, and if you did make a choice here, you just want to select this so that the filters were set based on your search specifications. Okay. All right, so for health plan, again, you're only going to be able to see members within your MCO, but you can break it out to those within the PCMH program or those within the THL program. So that might be something that's helpful for you. For this practice or training session, I'm just going to keep it open to all so we have some data to look at. You can also narrow down your ADT search by members with specific chronic conditions. So if you're wanting to see ADT information for all your members with asthma, for example, or bipolar disorder, you'd be able to select those, and you can select multiple for this dropdown. You can also select searching for members with specific risk status. So maybe you're wanting to search for all your members with asthma and bipolar disorder that are high critical risk. Then you could select those parameters here. And then finally, you can do a search by members county. So this is the members county of residence, not the county for which they were either admitted or discharged from the hospital. So once you've set all your filter specifications, you will click on the magnifying glass search icon, and it's going to pull all of the information related to your specification. Just while we're waiting for this to load, once it's loaded, you do have the ability to indicate how many individuals you'd like to see per page within the tool. So you can go all the way up to 100. And then you can scroll through here for the different pages. So once the data is pulled, you'll be able to see their member name, the region, and for MCOs, this is just going to indicate whether they're part of the THL program or PCMH. And this is also going to indicate when the member was admitted on, if they've been discharged, when they were discharged, the visit type, so inpatient or emergency, status would be admitted or discharged, the assigned provider, the source, so where the ADT information is being sent from, and then we have their prospective risk score. We can also export this data to Excel, and that's going to give you a little bit more information than what we can see here on screen. So let me just take a minute to let that load, and I will show you what that looks like. All right. Apologies, looks like it's wanting to stall. Not responding. Okay. 1 second. Sorry for the technical difficulties. Here we go. Okay. So you can see here we get a lot more information than we were able to see within the actual screen of the ADT search once you export to Excel. So we have the beneficiary status, which is their TennCare status. So they are currently active. We have their member name, their date of birth, age, gender. We also have race and ethnicity as reported. Race is usually reported more often than ethnicity is. We also have their full address, so you know, their city and state, as well as full street address, zip code, their county. We have their phone number. We also have the region, again, so are they THL or PCMH? We have their MCO member ID, social security number, their assigned provider, the risk status, and the risk score. We have any chronic conditions that may be listed out for the individual. The MRN, which would be from the source providing the ADT information. where the member was assigned within the hospital. So whether it was a surgical wing or maybe it's just the ER. And this is all dependent on what is sent over by the source. So if the hospital is not completing all of the information, such as where they were in the hospital, this could be blank, which is why you'll see some blanks here. We also have the date they were admitted. If it was an ER, when, so the time of the ER admission, and then we have discharged on if they've been discharged. We also have the visit type, so inpatient versus emergency, or status, so admitted versus discharged, and then again, the source where this information came from. So it's a lot more information once you get it to the Excel, and then you can put on those filters and do more data analysis or deep dives based on what you're needing. Any questions on the ADT information? All right. So again, this is the same view as a practice administrator or care coordinator for the ADT search. The only thing that you don't have is that care coordinator specific search. That's really the only difference. And then the last item, just pointing out those forms, resources, education. If you're wanting to see those coding guides, for example, you'd be able to come over here to forms, resources, education, and they're listed out here in the reference guide. So our training environment does not have that, but if you're logging into the actual tool, it will have that information. So I know we're at time, so are there any questions that I can answer before we end for the session? Oh, you're very welcome. So any other questions come up, just definitely reach out. Care.cct@tn.gov.
Hey, Allie.
Those questions answered for you. Yeah.
Hey, Allie, I just wanted to say, because I know in your announcements you had that if anybody has any feedback on those login reports that you share with some of the MCO leads. So I just, if you wanted to mention that before everyone drops off.
Thank you. Yes, I didn't get to those updates. So yes, so I've been sending out the CCT activity, user activity reports for January and February. And they're all new formats. So if you have any feedback on how they are sent, please let me know by the end of this week. Otherwise, we're going to be formalizing those to be the format we send them to you each month. I haven't heard any feedback yet, so I'm hoping that's good news. But if you do have any questions or concerns on how those new reports are coming through, just let me know by the end of this week. Great. Well, thank you so much, everyone. I hope you all have a great rest of the day.
Thanks, Allie. Thanks, everybody. We'll follow up during the out-cycle calls next week on